This portion of Local Lifestyles is sponsored by Westside Chiropractic.
I'm at Westside Chiropractic with Dr. Jessica Ignacio, and we're in the baby room. Yes, babies and infants do come, and there are patients here, and she can treat your little one.
Absolutely. So it's interesting because I do adjust patients in here. We have the open room out there as well. That's always an option. So whenever I am adjusting a baby, it's always funny when a patient is watching me adjust a baby and their first question is, why are you adjusting a baby? Babies can't talk. They can't tell you what's wrong. What happens in infants? I then explain. That's a perfect time to explain to people. And I love talking about babies and I love talking about infants and how I can help them, because not only is it so important to keep and get that baby feeling better and back on track, but it makes mom and dad much happier.
You bet you've got a colicky baby.
Oh, absolutely, and that's number one. So that's what I always explain. Going back a little further, I always try to explain that the birthing process is one of the most stressful processes that spine goes through. And so what happens is misalignments take place, which means those vertebrae, believe it or not, babies and infants have the same amount of vertebrae as adults. They're just a little closer together. They're just itty bitty, but they get misaligned as well. Going back to what you just mentioned, colic. That is one of the biggest things, and that is one of my favorite things to fix in a baby. Because what colic is, as we know, well, if you had a baby with colic, you know what it is. There is no soothing that baby. The baby cries and cries and cries. Not hungry, not tired, non-stop crying. The baby's not in pain. The baby, what happens is the very top vertebrae is pinching that nerve, and that nerve is excited. So it's not in pain, but it's excited, and that's the symptom that they have. So, and much like if you ever had an experience where you're like, I just can't sleep, like I'm just restless, I can't sleep, that's kind of the same thing. Your nerves are irritated, and it keeps that excited state. So what I do is I adjust that baby. Now, it's different, and because of course they're little, so I use my instrument. So what this instrument does, it gets the same benefits as the manual adjusting. It just takes that force out of it. It adds speed to it. So it's very light. It doesn't even hurt the baby at all. They hardly even know. When they come back in, they're usually sleeping through the adjustment, so it's really nice.
And the mothers have got to be looking at you like, thank you so much.
Yes.
Because then you're stressed too.
Well,
I mean, the stress level for you is over the moon, so you have to adjust everybody.
Well, and and they just had a baby normally, so they need to rest and heal as well. But I also like babies because babies don't have, typically, they respond very fast to the adjustments. You don't have the years of rebuilding everything, and they don't do much to get it out of whack. So it's the turnaround and the healing, I guess, process is very fast. Colic, as I mentioned, acid reflux. So when the babies keep spitting up the food, usually it's a mid-back issue, and constipation, which is a low back issue. That means something's being pinched in that low back, a nerve's being pinched, it's not functioning well to the bowels, and then therefore they're not pooping. But an adjustment, a couple of adjustments usually gets them right back on track.
That is the best news of the good news.
I love talking about babies.
Well,
I love helping babies.
Tell, and she gets to use her little baby thing right there. And I like it. It works really well.
Yes.
Dr. Jessica Ignacio, bring your little ones in for an adjustment and have one for yourself. We'll be back.
This portion of Local Lifestyles is sponsored by Westside Chiropractic.